Hello. Many people think that dialysis is a death sentence. This was probably true about 30 years ago. With the current practice and the significant advances in medicine, dialysis can be a life-saving therapy for someone who has kidney failure. People used to think that dialysis is always a very troublesome treatment and their quality of life is going to be significantly low. However, there are people who are surviving for decades on dialysis. So how do we make these small changes in our lifestyles? Dialysis patients look into two different aspects. One is the physical well-being, the other is the mental well-being, which are equally important. When I say physical, you have to make sure that your exercise tolerance is better. Small physical activities. Start off with a brisk walk, which can slowly increase to brisk jog. Do you know that people do half marathons and full marathons? Regular dialysis patients are capable of doing it. However, it has to be slowly incremental in the process. Also, we have to look into the kind of diet that we take. A good, healthy, well-nourished, well-balanced diet helps in pickup of your muscle mass as well as your fat mass. This weight gain that happens with a good nutrition is not supposed to be removed during your dialysis ultrafiltration. That allows you to gain healthy weight, which was not possible when you had kidney failure. When it comes to the diet, a good diet with a low salt, high protein, high calorie diet is a very good diet for all of our dialysis patients. Usually we don't restrict too much. In Indian diets, we don't restrict them too much because our diets are already a bit low in the protein content. Then comes your mental well-being. As is rightly said, if there's a disease in your brain, it manifests in your body. So your mental well-being, I would urge all dialysis patients to do some pranayama, meditate, and any stress buster, listening to music, doing activity which makes them happier, keeping your spirit high, not by alcohol mind you, but keeping your regular spirit high. And these are the things that help you not feel like a regular dialysis patient. Apart from all these, there are several help groups. Talk to your fellow patients, have a personal talk with your consultant nephrologist. They can all help you grow out of this problem. And always, whenever there's an opportunity, opt for a kidney transplantation, because kidney transplantation, the quality and your quantity of life is supposed to be better than being on dialysis. However, just by being on dialysis doesn't mean death sentence. Please understand that we are all there with you and we wish you a great long life. What is the biggest challenge that you face on being on dialysis? Physical stress, mental, emotional fatigue, or is it the diet that you have to restrict a lot? For any problem, you can always consult us. Thank you.
Like, comment, and subscribe for more health updates.